some years as a massage therapist, and most of that time, well, 25 years, and then most of that time I did treatment massage. So you have to be a little bit of an anatomy nerd to be able to fill out paperwork for the insurance company, so you get paid. But so what my goal is to help you guys walk into the yoga room, and when you teach, to be clear that you understand and have confidence in what you're saying. When you ask someone to externally rotate their hip, I want you to understand what that means. Because think about externally rotating your hip. Where's your hip? My hips are here. How do I externally rotate that? Okay, so we're going to talk about all that. It's not what you think it is. When people say externally rotate your hip, they mean externally rotate your femur. This is your hip. So my whole deal is being really clear about defining terms, because sometimes I hear stuff and I go, that's not what that means. Or how would anyone else in this room besides me know what you're talking about? So I don't want you guys to learn every bone, where every bone is, every muscle, where every muscle is, where every joint is, what every joint does. That's not the purpose. The purpose is for you to have a good idea where shit is, and then to be able to walk in there and communicate it well. So, and with confidence, so that you know what you're talking about. Even if you're not explaining it to people, you have an idea in your head what you mean, instead of just saying words. Is that, in massage school, that also happened a lot, where people use words. Like, the one that really always pissed me off was toxins. You have toxins in your body. Do I? What the fuck are those? How would you know that? How would you know what kind of toxins I have in my body? I haven't drank any drain of the day. So those kind of words, I don't like when people just throw words out without understanding the definition in their head. And as a massage therapist, I learned really quickly that when somebody says, my shoulder hurts, they might mean this, 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 this. Who the fuck knows, right? So everybody has to be on the same page. And it will be better in the long run when you're teaching yoga to not necessarily use the names of the muscles necessarily. Some of them are commonly known muscles, like everybody knows where your hamstrings are. Probably everybody knows where your glutes are. But if you were saying you want to feel that in your QL muscle, or your IT band, or some people call it the T band. That's not a thing.
I know that.
So yeah. So we need to kind of have some confidence in what we're talking about. That's all. That's all. We only have, what do we have? We have 30 hours, right?
30 hours.
So I can't teach you all the stuff that I learned. I had to memorize, a bunch of muscles, where they originated, where they attached, all the movements that they did, and I memorized that stuff just long enough to take the test.
Yeah.
And then some of it stuck, and then some of it became important once I started touching people, and once I started going, oh, she's talking about peroneus longus, so I got to write that down on the paper. Or maybe I didn't know what muscle they were talking about, but I could feel where it was, and then I go get my anatomy book out and go, oh, I know which one it is now, and then I could write that down. As long as you know where to find the answer, you don't have to memorize all this stuff, so don't be worried that you're going to have to memorize it. Because we have to learn Sanskrit. We're also going to have to learn a little Latin, but not very much. relevant or not. But anyway, we have to tell you things, certain things that you may or may not give a shit about. So one of the things whenever professional people, doctors, nurses, whatever, are instructing each other on the anatomy of a body or the map of a body, they might use words like, well, it's the medial epicondyle. So you need to know what medial means, or it's the lateral epicondyle. So you need to know what lateral means in terms of the anatomy. So those are the kinds of things that we're going to talk about a little bit. Just so that you understand the words. For instance, prone as opposed to supine. That may be relevant to all of you. If you're in belly down Shavasana, you're prone. If you're in regular Shavasana, you're supine. So then we have little games to memorize these things. So soup, we're holding our soup bowl, right? Prone is the opposite. Dorsal as opposed to ventral. So dorsal's on your back, like the dorsal fin, right? So I have a little list of those types of terms and what they actually, and then the layman's translation. It's not science. It's not rocket science. So these are things we'll be using when we go over the skeleton. When you guys start learning about the skeleton, we'll go more into that. We need to talk a little bit about joints. Joints are important. When we're doing things in there or in here, one thing that's important, you want to stack joints because they're stronger when they're stacked. So when we're doing this, we're extending our wrists, which isn't great for our wrists. When we're doing this, we're stacking our elbow joints and our shoulder joints. If we do this, it's a lot harder than if we do this. So that's the reason it's important for you guys to know about joints, which joints are which joints, what they do, how they work, and the kind of trauma that can be done to them. If you're doing, if you're doing push-ups and you have your elbows out like this, you're going to for sure hurt your shoulders and your elbows. That's why Mary Ann says, put your wrists with your elbows, right? So, so these are the kinds of, this is the reason that we need to learn this stuff. There are several different kinds of joints. I got to go over this with you, but I'll just do it really quick. There's ball and socket joints. Should I move? No. Okay. So the femur, this bone here, has a ball and it goes into a socket. So it has quite a lot of range of motion. One of the things, well, we'll get into this later, but this, okay, when we look at this guy, he is an artist's rendering of what your skeleton looks like. And all of us have way more diversity in our skeletons than you would ever think. So, for instance, this is the head of the femur, and this is the neck here. And this guy has a really short neck of his femur, but it can be this long on some people. And the longer it is, the more range of motion, the more room you have to externally rotate your hip. And if it's a little short guy like this, you're going to come to a bony stop in this fossa here, the hole that the ball goes into. So some people can't do this because there's a bony stop. And no matter how much stretching you do, you're never going to get past that bony stop. So that's the reason we need to learn about joints. We need to learn about the bones and all that shit. So anyway, ball and socket joint. Ball and socket joint. So more range of motion. our shoulder has the most range of motion of any joint in our body. That's why it's wrecked so easily. There is nothing, tendons, ligaments, not much bone protecting you. But also, it's good to be able to do this, right? Similar, but we have protection in the form of our pelvis. So we don't as often fuck up the ball and socket joint of our hip. So that is a ball and socket joint. This is a hinge joint. So, okay, so like, do this with your arm. There's a stop. Do you feel that bony stop? Mm-hmm. That's not your muscles stopping you. It's stuck on bone there. It won't go any further than that unless you break it. So that's a hinge joint.
So is that, as we get older, especially hanging out with my mom and her friends, they talk a lot about hip replacements as we get older. Is it that joint, that ball joint?
It's usually the acetabulum, which is the hole that it goes into, that wears down over time.
Okay.
There's also a capsule in there that holds synovial fluid, and that will wear out over time. Yeah, there's lots of reasons why that can go wrong. Yeah, a lot. And once you break your hip, you're in trouble in terms of old people. Mm-hmm. That's not good. Condyloid joints. It allows movement but no rotation. So your finger joints don't do this very much. Your jaw, condyloid, they'll open and close, but they don't twist. This joint, you can pivot a little bit, right? A pivot joint is, for instance, so this is your axial skeleton. It's not the core because your core is more down here, but this is called your axial skeleton. This is your appendicular, your appendages. So up here, where your spinal column connects to your skull, there's a little navi at the top, and there's a little receiver in the skull. That's a pivot joint. Gliding joints. So our forearms, these bones here, your ulna and your radius, they can do this. Oh shit, yeah. So they
cross over.
So there's joints here, there's joints here. Yeah,
they came up over here.
Yeah, it should be.
Okay, can you check, because otherwise I'm going to move.
Well, it's okay because we'll get further into this as we go.
Okay. All right.
But yeah, if you want to ever come up and play with the skeleton, be gentle with him, but you can kind of see it gives you greater range of motion.
Fascinating.
So we can supinate. And pronate that part of our body.
What was that called? This was
Gliding joint. Yeah. Saddle joint. Your thumb, I think, is the only saddle joint. It's a real specific, very unusual joint that only humans have. Opposable thumbs. So it's what makes us be able to create tools and stuff. And it helps us destroy the planet better.
Is that a primate thing?
It's a primate thing, but for instance, great apes they have a thumb, but it doesn't do this.
Okay.
It's not as articulating as our thumbs.
I know this isn't really relevant right now, but talking about joints, is there a time where we can talk about like people that are like hypermobile and how to make like adjustments and accommodations for people like that?
Yes and
Okay.
no. Okay, so, boy, we're going to have to talk about what you like this, and their head's gonna walk here, and they're not gonna feel a goddamn thing. They can't get a stretch, people that are hypermobile. They can't feel a stretch. Like I know one woman, she comes here, her legs go like this, and her head just squats down, and I'm like, do you feel that? No, not even a little bit. So yes, and there is a way to fix that for her.
I ask because it's my daughter's hypermobile, and we do a lot of yoga together, and I've tried to find like her like trying to keep like a little micro bend, and like she gets pinches in her nerves
Okay,
and she gets pretty.
so she's got to regulate her own self.
Yeah.
You've got to be clear with her that if something doesn't feel good, she needs to back off.
Okay.
Because there's no way for you to know, like if you see
Right.
somebody whose elbow goes like
Right.
this, it doesn't matter.
Yeah.
If they're comfortable in their shape, then perfect. But if somebody is like this lady I'm talking about,
Yeah.
you can use blocks to prop the ankles and under the abs. So you've lifted her up,
Yeah.
and now she can bend all the way forward and put her head below her ankles and her abs. And then she might get a stretch.
Okay.
But yeah, you gotta be really careful. The only thing, if you see somebody that's in a really weird fucking position and it worries you, you say, what are you feeling? And they say, fine. And you go, what are you feeling? And they might be able to say, well, I mean, I feel a stretch right here, or whatever it is. And then you might say, well, are you comfortable? And if they say yes, then you're all good. Walk away. Because you can't tell what they're feeling on the inside.
Yeah. Okay.
And we all have to be, like, I give a little more leeway because I'm a massage therapist, but as yoga teachers, you can't diagnose, you can't make a guess, you can't suggest a thing. The most you can say, if somebody is like, my knee is so painful no matter what position I'm in, you should go see a doctor about that. You can't really say, well, but I mean, if somebody's saying, when I do this, my knee really hurts, well then you go, oh, try this. But if everything hurts, they need to take care of it.
Pass the baton.
Yeah.
That's known as scope of practice.
Yes.
In other
Yeah.
words, you're not a doctor, like she said, so you have to be careful with your scope of practice. And some yoga teachers take it a little bit too far.
Yeah, you gotta be super careful. Because you just don't know what's going on with the person, and you don't have time in a class of 20 to figure it out.
Right.
But if they come up to you and or if you see them grimacing or something, you can approach them and say, what are you telling me?
I like the what are you feeling?
Tell me what you're feeling.
Investigating what's going on.
Yeah.
Yeah. I
And
like
it-
that. Okay.
And if they say fine, that's not a good answer. You need to be, but I see you grimacing, are you in pain?
Right.
Or are you in discomfort? Find a word that works for them. Because some people think that it stretches pain. So,
Yeah.
that's the thing. There are so many grades of every spectrum that you just gotta check. So your vertebral column, those joints are called, some people refer to them as compressive joints. So
I sure do.
your vertebra, have these little cushions, they have in between each vertebra, there's a little cushion. And when somebody says they have a bulging disc, they may be referring to this little ditty because he doesn't bend very good. But like if you do this all the time for 30 years, it's possible that your disc might pop out the back, bulge out the back. And when that happens, that disc may come in contact with one of the nerves coming out of your spinal column and compress that nerve and cause you pain.
Uh-huh.
And so sometimes they'll give you an injection to relieve the inflammation. Sometimes they'll fuse the, a lot of times, sometimes they'll fuse the joint so it doesn't move at all. Blah, blah, blah.
Sometimes they even cut off the sides that are sticking out so that it doesn't come in contact with the nerve and you don't get fused.
Yeah.
But then you have to be
They
careful.
just shave the disc a little bit, yeah. So there's a lot of things that can happen with that. Also, a lot of times, a bulging disc doesn't mean shit. Like, here's one of the problems. When a doctor does an x-ray, he can only see the bones. He might see a little bit of a disc coming out one way or the other, or an indication of that. And he'll decide from that that's where your pain's coming from. And maybe it is, or maybe it's because you've been doing this for 30 years, and what we need to do is fix this by doing this. So that's why when you do supported bridge or supported fish, you're opening your chest up, you're turning your vertebral column from impinging these discs this way, you're giving them an opening now so that they can breathe. So a lot of times when doctors do x-rays and they see some crazy shit, they go, that's definitely it, and then they fix it and you still have pain because that's not really what it was, but it looks bad. It's kind of the chicken or the egg. Are your discs bulging because you're doing this? And maybe they'll go back in a little bit if you do this. And I'd rather be trying to do this more than get surgery. That's just me. So, it's worth a try. I had debilitating back pain. I had back pain so bad. Now, also, let's go back to the whole nervous system shit. So, a few years ago, my brother died. And it was, stressful. And I had to go down to his house, and I had to do a lot of, yard work and moving furniture and this and that. And one thing I know for sure, and I know this from experience, is that when you're in grief, you're not very mindful, so you do stupid shit, fall down and whatever. And when you get hurt and you're in a traumatic situation, that pain takes a lot longer to go away. So I didn't do anything that I had never done before. But at the time, and for many, many years, I drove a clutch. And when we went down to his house, it took 6 hours on a Friday night in rush hour traffic with a clutch, and it was 80, blah, blah, blah. And then I slept on beds that I wasn't used to. And anyway, after the whole thing happened, my back kind of bothered me. And I just thought, I would just keep doing yoga. It's going to be fine. And then it really wasn't. And then COVID happened. And then I gained 30 pounds. And then it was so bad, I would go to tie my shoe, and I would have to put my foot up like this and bend down like this, and I would see stars. That's how bad it hurt. So finally, I'm like, all right, even though I don't trust doctors because I worked with them for a decade, I'll go because I can't live like this. So I go to the doctor, and they x-rayed me, and they went, oh, your back's a mess. And, I've ridden horses for years, so. For 4 years. Yeah, of course it looks bad. But I thought, you know what? And then they wanted to do some injections and blah, blah, blah. And I was like, nope. I got a stationary bike, and I got up to 20 miles a day, and I did 20 miles a day, 4 days a week. And then after COVID, because then I lost 30 pounds, and then after COVID, I came back in the hot room, and I still hurt. I mean, like, I couldn't do plow pose at all. And a lot of times I couldn't do this, and I'd have to crawl up like this, So, but now I can do all this shit, and none of it hurts. So it's not always when they look at the guy's hop to fascia, we'll go back to fascia, but just to say this. Scientists are now, the idea of consciousness is a real tricky subject when you're talking about reductionist science, because they can't put a finger on it, they can't describe it, they can't see it, they can't touch it. But they are now thinking that perhaps subconsciousness lives in your fascia, and because of that, trauma goes directly to your fascia. So, unfortunately for us, or fortunately, your fascia is in every part of your body. So it's connective tissue, it goes up into your brain, it goes into your eyes, it wraps around every muscle, it wraps around every organ, it actually wraps around the fibers in every muscle. And it's piezoelectric, so it conducts electricity. It's got more nerve cells in it than any other part of your body. So if you're feeling muscle pain, you're probably feeling fascial pain. So fascia is remarkable. It's a sensory organ. It's what allows us to be able to know where our nose is with our eyes closed, or that the wall is right here. So anyway, it's just super important, and it has a lot to do with the nervous system. They are connected. So anyway, joints are not always the problem when you have pain. Synovial joints, those are joints that have a capsule with a fluid inside called synovial fluid, and it's like oil that lubricates so that you can all these things. So if those joints get ruptured, or if your body isn't really good at making synovial fluid, you can start to have joint issues with joints. And then I was going to talk about, so axial skeleton to here, appendicular skeleton. These are things that yoga online is not supposed to. Shoulder girdle is this area here that comes off of the appendicular skeleton and kind of holds your humerus, this bone here, in place. Or not really, but protects it slightly. This is your pelvic girdle when people are bringing up. Condyle. So a little bit of terminology. Condyles are, when you see these little funny pointy things, these bony landmarks on the skeleton, this is where you'll see, like, so it'll be like smooth, 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 and then weird pointy, like this. This is where a tendon attaches, a tendon of a very strong muscle. So like, when they find ancient skeletons in Mongolia, and I'm thinking of this queen that they found. Maybe she was a very wealthy woman because she was buried with her horses and her all of her gear. She was a kind of a warrior princess. She had really, really strong bones, pointy, bony prominences right here, where your adductor muscles attach. Adductors. So she strengthened these muscles to the point where the skeleton had to reform over and over to support those tendons.
Wow.
So that happens. If you're a weightlifter, you might have. So condyles, back to condyles. So condyles are places where tendons that go to very strong muscles attach. Tuberosities, again, tibial tuberosity. So this is a tuberosity. This is again where another tendon attaches. This would be where the tendon for your quadriceps attached to this tuberosity. at the condyle. So if condyles are these bony prominences, epicondyle is the bony prominence that's up slightly above that. Plateau is where there's a little flat spot